Okay.
Tetano.
Priya, all the best.
Miss Laiva.
Okay, Priya.
Education is the passport to a future, for tomorrow belongs to the people who prepare for it today. A pleasant morning to everyone present here. Myself, Priya Mary John, first year BSc Psychology. Welcome each of you to the 5th session of Psy Hub, the international webinar series conducted by the Postgraduate Department of Psychology and Internal Quality Assurance Cell of Christijodi College of Management and Technology. Prayer is an active force. Prayer is the key that can open the door of heaven and rain down every hidden treasure that is our inheritance. So let me call Alina Anna Thomas, first year BSc Psychology, for her recital.
Am I audible?
Yes, Alina.
Light of the way, you step down into darkness. Open my eyes, let me see beauty that made this heart adore you. Hope of a life spent with you. Here I am to worship, here I am to bow down, here I am to say that you're my God. You're altogether lovely, altogether worthy, altogether wonderful to me.
Thank you, Alina. KCMT proudly hosts the Psy Hub series under the auspices of the Department of Psychology, opening up new vistas which would be a learning experience to the student and like-minded community. Higher studies and job opportunities for psychology is the first in the list, opened a window to the states with its ample opportunity. The second session, Hurried Woman Syndrome, dealt with the need to be aware and how to tackle the issue. The need and urge to show one's assertiveness was the third in the series, which set a benchmark to march on. Fourth session highlighted the role of psychologist in the society, which is prominent during these testing times. To build yourself as a branded psychologist was really an arena to trend on. And today, we look upon another continent and its expertise of mental health service system, career pathway, and job opportunities in Australia. May I welcome Mr. Sijo P. Jacob, Assistant Professor, KCMT, to welcome the gathering. Over to you, sir.
Am I audible?
Yes, sir.
A very good morning to one and all. Most respected head of the Department of Psychology, Dr. Angel Thomas, our chief guest and the keynote speaker of the day, Mr. Gaudy Sebastian, a clinical psychologist from the Victorian Public Health Services of Australia, and my dear faculty colleagues, Department of Psychology, as well as the entire college, and dear students, dear participants who are watching this program in YouTube and also in Zoom. So all we know, this is the 5th session of Psy Hub series. Psy Hub series is getting a warm welcome and a wide acceptance from the different arena of students, researchers, and society. So because through the Psy Hub series, the department have arranged a platform to discuss the academic realms of psychology in its employmentability and also its job opportunities. The different experts joining in the Psy Hub are well-established clinical psychologists, academicians, and researchers. Today, it's our proud and pleasure to have the presence of Mr. Gaudy Sebastian from Australia. So as we know, he is an eminent expert in clinical psychology and also in the mental handling of different patients. He have been in the field of psychology for last 10 years and well established in Australia. Seeded from the hills of K College, as Angel Madam said, seeded from the hills of K College. So we know now he established in the continent of Australia as a huge tree who can help others in handling their mental problems and establishing a successful life over there. So dear sir, it's our happy and proud pleasure to have your presence in Psy Hub series. In the name of KCMT College, in the name of our beloved principal, Father Joshi Shiramguri CMI, and also in the name of our dear HOD, Dr. Angel Thomas, your friend, and in the name of the entire department, faculties, students, I'm extending you, sir, a heartfelt welcome to Psy Hub Series 5.
Thank you.
Dear, I'm welcoming our dear HOD, Dr. Angel Thomas, who is a driving force behind all this. Without her effort, it could not have been done. Anyway, I'm welcoming dear HOD, Dr. Angel Thomas, to the Psy Hub Series 5.
Thank you, sir.
Thank you, madam. And I'm expressing my heartfelt welcome to each and everyone who is watching this program in Zoom platform and YouTube. Welcoming all to Psy Hub series. Thank you very much and have a nice day.
Thank you, sir. Now, I request Ria Susan Varghese, first year MSc Psychology, to introduce our resource person.
Good morning, everyone. I'm happy to introduce Mr. Jordi Sebastian, clinical psychologist, who is the guest speaker to the 5th section of the international webinar series, Psy Hub. He had completed his undergraduation from K College, Mananam, which is affiliated with MG University, and post-graduation from Kerala University, Thiruvananthapuram. He did his MPhil in medical and social psychology from CIP Ranchi. He previously worked in Kasturba Medical College, Manipal, Sikhism Manipal University, and at Marian Medical Center at Pala. For about 10 years, he's been working in Australia, both in private and public mental health centers. Currently, he works as mental health practitioner in Victorian Public Mental Health Service, Australia. So, we are most excited to have you today for this section. Welcome you, sir.
Thank you.
Thank you, Ria. Now, let's move on to the much awaited session. As you progress through the session, list your queries or doubts in the chat box and also do complete the feedback form. Let me proudly call upon the renowned speaker, Mr. Jordi Sebastian, mental health practitioner from Australia, for the session. Over to you, sir.
Thank you. Good morning, everyone there in Kerala and India. It's afternoon here in Melbourne. Thank you very much for giving me this opportunity. Thanks for the organizers and especially for Angel Miss. I'll just bring in my slides to start with. Can you see the slides?
Sir, it's loading only. It's loading.
Okay, okay. Just a second. I'm sharing my screen. And
yeah, now it's visible. No problem.
Okay. I'm starting a
Now
slide.
possible if it is possible to make it full screen. Okay, right.
Is it full screen now?
Okay. Now, yes.
All right. So as you can see in the screen, when Angel Miss told me about the international webinar series, I thought as students and also fellow psychologists in Kerala, you would be interested to know how the mental health system work in foreign countries, especially developed countries like UK, Australia, which are all similar systems. I have been working in Australia in the public mental health system for about 10 years, and I also work as work in private practice as clinical psychologist. So I thought it would be interesting, and you would be curious to know about how the system work here, how someone in a community would go through the journey in their mental health issues. So maybe I would ask to imagine somebody who who is going through a mental health issue, or somebody who has some chronic mental health issue, maybe one of your friends or someone in the community, or maybe one of your relatives, or you can even imagine yourself going through such a journey. So keep that in your mind when we discuss the mental health system, and imagine the person in your mind going through their journey of mental health issues and treatment, and how they complete that journey or keep going in that journey. Some disclosures. This presentation is not a legal advice, so just take it as some information that comes from my best knowledge and experience. So let us have a look at how the mental health system work in Australia, and then I will move on to the opportunities for psychologists and study opportunities, and then I'll be happy to take some questions as well, and I'll try to answer that as much as possible to my best knowledge. So different layers of mental health services are there in Australia, and I will be talking particularly about Victorian mental health system, because mental health system is unique to each state, but similar, but they have their own mental health acts, mental health laws and systems. Similar, but slightly different. So I'll be focusing on what I am used to, which is Victorian mental health. So there are basically three layers you can see: public mental health services, private mental health services, and then various mental health support services. And I cannot number the mental health support services. There are lots of services which are supporting mental health system, like NGOs in India. So moving on to public mental health system. Public mental health system is fully funded by the government, whereas private mental health system is funded by Medicare, which is kind of government insurance, government health insurance, which all of us are paying, and also private insurances, or any also out-of-pocket expenses for private mental health system, but public mental health system is completely government funded. In Victoria, there are various area mental health services, geographically and divided based on the population as well. So in Victoria, there may be about 15 or 16 various area mental health services, which are governed by independent governing bodies or trusts. So public mental health system can be generally categorized into inpatient services and community services. Inpatient services, one important difference that you would see in these countries, in developed countries, is deinstitutionalization of mental health. That has happened in Australia in the 90s. So by the end of 90s, almost all the big mental health institutes and mental health hospitals and asylums have been abolished. Their operations ceased, and the system changed into a new model. So until then, we also had big hospitals and mental health asylum type treatment settings, like what you see in Ranchi or in Tribunal, big mental health hospitals where clients would be staying for years and years. Now the system has changed from that 90s. So the current system is there are inpatient system, but that is attached to general hospitals. Like any other medical wards, there would be a psychiatric ward, but this is not intended for a long-term care, but it is for acute treatment only. So which means somebody brought in or admitted to a psychiatric ward may stay there maybe a couple of days or maybe a couple of weeks. Most of the time, it may be a couple of weeks, a week or 2 weeks or maximum 3 weeks. There may be times they may stay for 2-3 months. So that will be the maximum. So it is for acute treatment only. So inpatient setup, we have adult inpatient units specifically for people between aged between 18 and 65. So they have a separate ward or wing for treatment, and there are separate wards or treatment units for older adults, another separate unit for child and adolescent age group. But these, not all hospitals have all these. Child and adolescent, for example, may not be available in all the hospitals. So in that case, those clients would be attending those hospitals if they need admission. But all these units work in a similar way. It is separated only because of the needs for different age groups. So for example, adult inpatient unit, there will be psychiatrists, mental health nurses, social workers, and psychologists doing their role in the acute phase of the mental health issue for assessment and treatment and to liaise with the community and the family. So where social work comes in, mental health nurses there do their job, like the monitoring of their mental status when they are in the ward, and obviously monitoring the medication. So in these inpatient units, there would be general areas where each patient will have their own rooms, but there will be common areas. So they are relatively free in that area. But there are secured areas. They are called in different names in different hospitals, but secured areas or secured unit for clients who have aggression, or there is a risk of harming themselves or harming others. So they may be attending that unit for the time period where they are experiencing these kinds of issues like aggression or other risk issues. So there are certain regulations when people are moved to such areas. They need very frequent supervisions, like at least once in 15 minutes. There are it's all regulated like that. Other inpatient units are similar. Older adults also has similar setup, child and adolescent. Another area that we would see is consultation liaison psychiatry. So this is again inpatient provision of psychiatric care, but this is for those patients who are in general medical ward in a hospital, but who has mental health issues as reported by the consultants or the nurses there. If they think that, okay, this person in this general ward has some mental health issues, maybe feeling down or some eccentric behaviors, so then consultation psychiatry will get involved in their mental health management, which again includes a team of psychiatrists and mental health nurses. Then perinatal mental health unit and mother and baby units. Again, not all hospitals have this, but there are hospitals who have these kinds of arrangements. This is specifically for perinatal mental health, just before and after the birth of a baby. Maybe the mental health issues come in that period, like postnatal depression, or when someone who has significant mental health issues when they deliver a baby, so they are cared for in this kind of perinatal mental health or mother and baby units. Now comes community mental health service. This is the huge change after the deinstitutionalization of mental health, which happened in the late 90s. So what happens is, after the acute phase of treatment of anyone, including chronic severe mental illness, schizophrenia, bipolar illness, even chronic severe mental illness, or even other mental health issues, depression, anxiety, whatever. Once that acute phase is over, they are discharged to the community. So there is a separate community mental health team dedicated for adult population, which is called Adult Community Mental Health Service, Aged Community Mental Health Service, Child and Youth and School Community Mental Health Services. There is youth specific. Then there is another separate wing for early psychosis. Early psychosis means someone in their early ages, like 16 to 25, when they start experiencing psychotic illnesses. I'm not explaining all those terms now. I hope you may have an idea about what is psychosis. So there is separate wing for that as well in the community. So it runs on certain models. We can call it case management model. What happens in case management model is that when someone is having some significant mental health issues, but they are ready to, or they are able to live in the community, but they still need mental health follow-up for monitoring of their mental health status, or for monitoring of their medication, or to make sure that they are living a quality life in the community. Each of those clients would be allocated a clinician, and they are called case managers. Okay, when they are allocated like that. So this is called the case management model. So a case manager may have 10 or 15 or 20 of such clients they look after in the community. So they are responsible for their monitoring of their mental health and to make sure that they are still able to continue to live in the community and they are living a rich and full, fuller life in the community. So this is case management model in a nutshell. So then another approach is called recovery model. Recovery model is that, there is another slide for that. Recovery model means that the treatment, mental health treatment, means that it is not just focused on symptom relief, okay, but it is more about the recovery of that person from the mental health issues, which means that even if there are some symptoms, residual symptoms, we are talking about severe mental illness here, even if there is residual symptoms after the best treatment or even during the ongoing treatment phase, how they can live a rich and full life in the society, taking care of their wishes, their values, what they want to do, how they want to their live, how do they want to live their life. So taking care of all those issues, how best the mental health system can support them to live that full life in the society. So that is recovery model. Then this community mental health team, it's a multidisciplinary team. So it is led by a psychiatrist, and it also includes mental health nurses, psychologists, social workers. So it's a team. Depending upon the needs of the client, they will get according, inputs from the specialist. Then there is acute community assessment teams. Okay, so when somebody is referred to a community mental health service, sometimes, as I just mentioned, it may be a transition from inpatient acute treatment, and then they are coming to the community. So a community clinician or they will be referred to a community mental health team. But there are situations a community mental health team will be getting referrals from other places. For example, someone present to the emergency department of a hospital, and the hospital, treating team, the doctors, emergency doctors, or the mental health, the nurses there think that, okay, this person has some mental health issues, or this person is showing aggression, or too down, too depressed. So they would need a mental health assessment. So there is an emergency, there is a mental health clinician in the emergency departments of the hospital. So we call them ED clinicians. So they are responsible for assessing them, in that point. Then community-based assessment. So I will talk about the referrals later, but we get referrals from anywhere in the community. So when we get a referral, a mental health clinician goes out to the community, or they can call the person into the mental health community treatment center. And usually the clinician goes out to the community to know well about the person and their living circumstances. Usually that's the practice, that we go out to the community, go out to the person's home, wherever they are, and do the mental health assessment. Okay, so that is community-based assessment. Again, depending upon the severity, that comes with the referral, that, okay, this needs an urgent, or this is a non-urgent assessment. So that is time frames. Then mental health, the police response. So when police come across someone and they think that, okay, somebody needs mental health assessment, usually there are clinicians associated with the police team, so that they don't have to go through the referral and the clinician has to go there. No, there are clinicians attached to the police team. So that also happens. Not in every police station, but there are such arrangements as well. Then mental health, the court assessment. So there are clinicians sitting in the court. So when somebody presents to the judge and the judge wants this person to be assessed for that person's mental health, yes, there are on the spot clinicians there. Again, I'm not talking that it is available in all the courts, but this is the case. Then some other community mental health services are community residential care units. So this is, if you think about those people who used to live in the asylum kind of setup, who used to live all their life in the community, in the asylum. So such clients, after their acute period, this is a community residential care unit where they almost live independently, but there would be some kind of supervision for medications, and there would be a nurse available, but they are not in a closed setup. They are living in an open setting. They can go out and come back, but there would be some level of supervision, and this can go for 6 months, 1 year, depending upon the needs. But again, the preference is, again, get them back to the community where they can live their full and rich life. Then prevention and recovery care team. This is a step up, step down kind of facility where either after the acute phase of treatment, this person is not fully ready to go back to the community. They need a bit more intense supervision, so may not be ready for the community clinicians to look after, because that is not 24 hours. So in such case, this is a step down facility. It is called Prevention and Recovery Care Park. So there is adult and youth wing of that. And also it is also used as a step up care service, like when somebody who is in the community already case managed by community clinicians, but they notice that, okay, this person is getting unwell, they need a bit more constant supervision, then they can come to the park or prevention and recovery care facilities, monitor there for some time. There is a psychiatrist, manage, and they may be able to go back to the community soon, like after a week or so. Then supported accommodation, a little bit lower level of accommodation. That is, we are providing accommodation and very low level of supervision. Then mental health counseling services. There are community health services, not community mental health services, community health services, and there may be counseling centers in those kinds of general community health services. So there, people with minor mental illnesses, anxiety, depression, OCD, those kinds of issues, or relationship issues, they will be able to avail counseling services from, various places. I'm just giving this as an example. This community health service, there are various models that works and provide such counseling services. So usually psychologists or social workers provide that kind of services. Now, key workers in the mental health system, public mental health system, is one is called mental health practitioners. They are also called mental health clinicians, or sometimes when their particular job is community clinician, they are also called community clinicians or case managers. So a mental health practitioner could be either a mental health nurse, social worker, psychologist, or an occupational therapist. So either of them. So usually every team will have at least one or two from these each of these professional group. Now, medical officers are also part of the mental health team, psychiatrists. And when we talk about psychiatrists, there is specialities here, for psychiatrists who specialized in older people. So they are called aged psychiatrists, child psychiatrists. So there are specialities. And adults, most psychiatrists can see adult patients. Then community or inpatient mental health system, they also have consumer and carer consultants. So consumer consultant is somebody who had lived experience of mental health. So they were patients once and they are recovered now. So they are employed in the mental health system to connect with the clients. And carer consultants, so those who have performed the role of a carer, so who had looked after mental people with mental health issues, so they know the challenges the carers are going through. So carer consultants are also employed in the mental health system to support the carers. Now, mental health system follow regulations, and these regulations come from the Mental Health Act. So some of the key concepts I would like to mention for your interest is involuntary and voluntary treatment. So most of the clients that we see and treat, they are voluntary patients, so they are willing to get treatment. But there may be circumstances where people, either because of their lack of insight, they don't know that they are going through, mental illness, so they may not be willing for treatment. So in that case, there is strict criteria and guidelines. So when can we compulsorily treat someone for mental health issues? So that is called involuntary treatment. So a mental health clinician or mental health practitioner, as we mentioned earlier, it can be a psychologist, a mental health nurse, social worker, or occupational therapist who is working in the public mental health system. So they have the authority to bring in clients for a compulsory treatment. So we can use assessment orders. As mental health clinicians, we can use assessment orders, which is a paperwork or an authority for the clinicians to authorize this person to be assessed by a psychiatrist. So once that assessment order is in place, after you go out to assess a person in the community or wherever, and the person is not willing for treatment, but we think that that person has mental illness and he needs treatment due to risk issues, maybe the risk is for him or for others, then we use this authority to bring them to treatment. So we can use the help of police to bring them to treatment. So once they come to the treatment, they can still still they may not be willing for treatment. So the psychiatrist can put in temporary treatment orders which last for 28 years, which makes them compulsory, that okay, they have no choice, they have to undergo treatment. But after the 28-day period, if the psychiatrist and the mental health service team, they think that okay, this person need more treatment beyond 28 days and they have to get that treatment compulsorily, then there is further layer of protection for the clients. This is called the mental health tribunal. So further compulsory treatment needs to be approved by a mental health tribunal, like a small court, which consists of a lawyer, a psychiatrist, and a community representative. So the mental health team, a clinician or a psychiatrist, has to present the case to the tribunal, and the client also will be present there. They can avail the help of a lawyer. So after the presentation, the mental health tribunal will approve it or reject it. So this is the criteria for involuntary treatment, for treatment orders or to make assessment orders. So I'm not going into the details of that, but when a clinician think that a person has a mental illness and because of the mental illness, that person needs treatment, to prevent a deterioration of that person's mental illness or to avoid harm to self or others. And this treatment, this can be, or this assessment can be provided. So then we can use the assessment order or compulsory treatment. And these are the recovery principles that I have mentioned. So we work based on these principles. So the goal or the principle, the model is recovery oriented. And the aim is to not only the symptom reduction, but to, all these principles, foster an understanding of person's strength and wishes and opportunities, and respond to their strengths and preferences and concerns and their needs and goals and values, and respond to the things people, activities and roles these people think and identify as important to them, not for us. So what they think is important in their life. So it is the mental health system and the mental health clinicians try to help them to achieve their values and their goals and promote their decision making. So these are the guiding principles. Then, so this is all about the public mental health system. Now comes the private mental health system. We have private hospitals, private psychiatric hospitals. Again, the guidance is the same. It's short term, in the sense like 2-3 weeks to maximum 2 months or something like that. Usually in private hospital it may be around a month or less than a month. So and they cannot treat anyone compulsorily. It's only for voluntary patients. And then clinical psychology and psychology services, that happens in the community privately. So we can have private psychology and counseling practices, which can be run by clinical psychologists or psychologists. So we can provide psychology services in the community privately. So, and similar services can be provided in the community privately by mental health nurse practitioners. So they are a bit more qualified mental health nurses. Social workers are also allowed to provide, counseling interventions for people with mental health issues in the private setting. Okay. And when they come to the private setting, so they are funded by the Medicare. So any citizen will have a government health insurance. So which, whoever working or whoever is on pension, they will be paying a small amount for this, insurance. So that is a health insurance provided by the government, but we have to pay for that. So usually some part of the expense will come from the Medicare insurance, or it can come from the private insurance, or the rest can come from out of pocket. So these are the referral pathways. If someone think that, okay, this person needs a mental health assessment. So basically anyone can refer somebody for a mental health assessment. General practitioners, they are the doctors. Usually that is another system here in these countries. When you develop a mental health, any health concern, usually you will have a doctor that you will be going to see. They are called general practitioners. So you go and see a doctor in that level. We don't go to the specialist directly. So usually it will be the general practitioners who would refer clients for either private mental health setting or public mental health setting. Then mental health triages are 24-hour referral intake services. So anyone can contact the client themselves or the client's family or friends. Anyone can contact the mental health triage, making a referral to that service. So the mental health triage will direct that client to the appropriate services. Then other mental health support agencies, they can also make referrals for to the mental health services. So there are lifeline which are when people are in mental health crisis, there are, as I said, there are hundreds of such support services in Victoria here. So those clinicians or the workers in that services, when they notice somebody need a mental health service or more intense mental health input, so they can make a referral. And Mental Health Compass is an interesting website which gives lots of information for anyone in the public. Next slide is, this is how it looks like. It gives lots of information, helpline, crisis support, hospitals, and it goes by the type of mental health issues. And if you click there, that will show you all the available services. So this is for the public. Now, coming to the career pathways and job opportunities for psychologists. So I'm leaving the mental health service system there. Now we are coming to the psychology specific career pathways and job opportunities. So psychologists with general registration. So for somebody to call a psychologist or put designation as a psychologist in Australia, they have to fulfill certain criteria. So this is the main regulation for that. Psychologists with general registration have a minimum of 6 years of university training and supervised experience. So 6 years study, or there are some other pathways which will make you equivalent to the 6 years study, which are called 4+2 pathway or 5+1 pathway. So 4+2 pathway, they are abolishing that pathway that is currently in place. This is 4 years university study in psychology. Usually a graduation would be 3 years, but honors would be 4 years. So BSc honors in psychology means that's a 4-year course, whereas general bachelor's would be 3 years. So if somebody has done only 3 years, they have to do 1 more year of additional study in a university. So then that becomes 4 years study in psychology in university. So that is the very minimum they have to have, to become a psychologist. So for such students who have completed 4 years of study, they have to have 2 years of supervised training to apply to become a psychologist. So that is the 4+2 pathway. Or somebody may have 5 years of study. So in that case, they have to have 1 year of supervised practice in addition to the 5 years of university study to apply to become a psychologist. Or 6 years study in a university can also make you eligible for applying for a psychologist position, or to become a psychologist, to register as a psychologist. So that 6 year study usually will be comprising of supervised practice as part of the course. So that is the requirement to become a psychologist in Australia. So career in public health for a psychologist. So we mentioned earlier in the public mental health system, mental health practitioners or mental health clinicians, community clinicians, they are the backbone of the public mental health system, or especially the community mental health system. As we said, after the deinstitutionalization, it became the community mental health service became the backbone. So people with mental illness, they are living in the community now, but they need monitoring, depending on the needs, but they need monitoring. So even community mental health service, they discharge clients completely into the community. In that case, they may have some other mental health support, support services, or they may be monitored by the general practitioners. But anyway, this community mental health system is the backbone, and the 4 types of clinicians that work there are mental health nurses, psychologists, social workers, and occupational therapists. So that's an opportunity for a psychologist to get into the public mental health system, or to get a job in the public health service. Then there are positions for clinical psychologists in public mental health system. So specific positions for clinical psychologists, neuropsychologists. I'm not explaining, what are they. Hope that you have an idea about them. Clinical psychologists, neuropsychologists, health psychologists, counseling psychologists. So these are specialities in psychology. I will come to that a little bit detail in next slide. So these are the opportunities for psychologists to work in public mental health, okay, or public health. Other career opportunities for psychologists to practice in private, so do private practice. You can be a general psychologist, a clinical psychologist, or a neuropsychologist, or a counseling psychologist. They can all do private practice. So again, the funding for the clients that can come from the Medicare system, which is the government health insurance, or private health insurance. The clients completely fund themselves through the private insurance, or it can be out of pocket. Okay, but to avail this government insurance, a client has to get a referral from a general practitioner. So they cannot just directly come to a psychologist and claim that insurance. They can come to a psychologist and have sessions for their issues, but if it is not referred by a doctor, they will not be able to get insurance claim for that. So a psychologist, clinical psychologist, neuropsychologist, counseling psychologist, they can all work in private practice. Then other area is school psychologists, educational psychologists. So there are psychologists who specifically work in school educational setting. Drug and alcohol services also employ psychologists. Justice and corrections, forensic psychologists, prison. So there are all psychologists working. Teaching roles for psychologists, research roles for psychologists. So these are all various career opportunities for psychologists. But public mental health is a major area where psychologists can get into. Now, this is another interesting area in psychology registration. So we talked about 6 years study for psychology to become a psychologist, to become a registered psychologist. But there is something called endorsement. So an endorsement indicates that a registered psychologist has a qualification in a particular area of practice, such as clinical psychology, and an additional 2 years more supervised experience. So what this means is that if you want to become a clinical psychologist, you have to have more experience and more specialized studies. So if you want to call yourself a clinical psychologist, you have to have specific qualifications in clinical psychology. If you want to be called or if you want to register yourself as a neuropsychologist, you have to have specific qualifications in neuropsychology, in addition to the qualifications that was required for a general psychologist. Okay, so that is, so with that additional qualification plus 2 years additional supervised training in that area. So if you want to become a clinical psychologist, a registered clinical psychologist, after becoming a general psychologist, you have to have a specific qualification in clinical psychology, also 2 years more additional supervised practice in clinical psychology. So that is the requirement to become endorsed. And this endorsement can be in different areas. So these are the 9 areas of endorsement for a psychologist. So clinical psychology, neuropsychology, clinical neuropsychologist, clinical psychologist, community psychology, counseling psychology, educational and developmental psychology, forensic psychology, health psychology, organizational psychology, sports and exercise psychology. So these are the 9 areas of endorsement. So as I said, general registration is a minimum requirement. And from that, if you have specific qualifications in one of these areas, plus if you have 2 more years of supervised practice, then you are eligible to apply to be called as, or to register as, or to get endorsement as, for example, a clinical psychologist or a counseling psychologist or an educational psychologist. So that is the requirement. And the duration of that course, usually 2 years. And when you apply for a course, that usually will indicate the pathways and what you will be able to become eligible for after the course. Now, psychologist registration and renewal. All psychologists are registered with APRA, which is Australian Health Practitioners Regulatory Agency. So for a psychologist to practice as a psychologist in Australia, you have to have a registration with APRA. And I told you the requirements to register as a psychologist, as a general psychologist, that 6 years study, or 4 years plus 2 years supervised, or 5 years plus 1 year supervised practice. So you have to have a registration with APRA. And for clinical psychologists, yes, bit more criteria, 6 years study, qualifications in clinical psychology, plus 2 years supervised experience, then you become a clinical psychologist. Again, you are registered with the APRA, or Australian Health Practitioners Regulatory Agency or Authority. Then you have to practice as a psychologist, you have to have professional indemnity insurance. So this is, if you practice in private, you are seeing clients, and if something goes wrong and the clients seek compensation, you are responsible for that. So you cannot run a clinic, or you cannot do private practice if you don't have professional indemnity insurance. So which covers for those circumstances. And this is a huge amount that we usually cover for. Usually it covers for 1 million or 10 million. So we have to take this insurance coverage. And if you are working in public mental health, your employer will cover you for that. So they will cover that insurance for you. And for renewal of registration, there is a mandatory 30 hours of CPD every year, and you have to produce evidence, or you have to have the evidence for that when you apply for the renewal of your registration, which includes, or in which 10 hours of mandatory peer supervision, where you discuss the clients that you are seeing with another psychologist, with your peer. Okay, and other 20 hours could be from any training activities or other learning experiences. So you have to have at least 30 hours of professional development, continuing professional development. So, and the study opportunities, in a university, you can go for a bachelor's degree or an honors degree. Honors degree is 4 years. Bachelor's degree is usually 3 years. Honors will give you 4 years degree, which is the basic for to become a psychologist. So under the current pathways, as I said, that will be abolished soon. So then you'll have to have 5 years of study in psychology to become a psychologist, plus 1 year supervised experience. Then other study opportunities are further studies after graduation and post-graduations, like diplomas. There are various diploma courses or PhD. Now, for us who completed their studies overseas, for example, in Kerala, in one of the universities in Kerala or India, for you to get a registration here in Australia, you have to get your degrees approved in Australia. And these are the agencies that do that: Australian Psychological Society, APS, or Australian Psychological Accreditation Council, I think it is that. So these are the two agencies who does that. Usually the overseas qualifications are assessed by APS, Australian Psychological Society. And then after assessing our qualifications, they will give you a statement or a report that, okay, your qualifications so far you have done in overseas, okay, this is equivalent to this many years of psychology study in Australia. For example, when I applied, I had a 3 years bachelor's degree and 2 years master's. Combined, they told me that, okay, this is equivalent to 4 years, because they were two separate degrees. So they did not combine it to 5 years study. They put it together as 4 years study. So they decide what is our qualification as equivalent to the Australian qualifications. Then further studies towards obtaining registration as psychologist or for area of endorsement. So once you get this equalization, then you know, okay, what you are equivalent to in Australian degrees. Then you know what else do you need to become a psychologist in Australia. So then you can look for such courses in universities. So for example, if you want to become a clinical psychologist, okay, your qualifications are already equivalent for 4 years or 5 years. Okay, you want to become a clinical psychologist, so you look for a clinical psychology course. So these are generally the psychology courses: bachelor's degree, bachelor honors degree, master's degree, DPsych, Doctor of Psychology, that's a degree, PhD in psychology, graduate and postgraduate diplomas. Now, psychology courses, again, applying to various universities. When you apply to individual universities, you look for the course guidelines for the pathways that each course is leading to. Okay, so when you look for a particular course, usually there will be some guidelines associated with information. Okay, if you do this course under APRA registration, this is what you will be getting or that you will be eligible for. Okay, if you do this course, that will get you the registration for as a general psychologist. Or if you do this course, this will be considered as the requirement to become a clinical psychologist or a neuropsychologist. So you need to look for that guidelines. All right, so thanks for your patient listening. So that's it from me for the time being. And thank you all. Thank you very much. And I will be happy to answer any questions to the best of my knowledge if you have any. Thank you. Over to you.
Thank you very much, sir, for providing much food for thought. After this wonderful session, it's the time to get the queries cleared. Sir, a participant asked, which has more scope, clinical psychologist or mental health practitioner?
As I said, clinical psychology is a specialty, is an endorsement. So in terms of scope, clinical psychologists can obviously apply for anything that a general psychologist can apply for. So a clinical psychologist can be a mental health practitioner, a community clinician, or a clinical psychologist can apply for a specific or work in a specific clinical psychology position, and also do private practice. So you have more scope when you are a clinical psychologist or when you have an endorsement in any areas, any of the 9 areas that I have mentioned there.
Sir,
Yes.
let's answer the question. General registration with Psychology Board of Australia. Can you comment more on general registration with Psychology Board of Australia?
General registration, what specific information I know is that person looking for? General registration, as I said, the minimum of 4 years university study is the minimum requirement, plus 2 years of supervised training in psychology is the minimum requirement to register as a psychologist in Australia. But as I said, that is a pathway that is currently there, that will be abolished in few years time. So then it will be 5 years study plus 1 year supervised practice. And this 5 years or 4 years study, or even 6 years, 6 years study in university will make you eligible for registration as a general psychologist. But if we are doing that study in India or any other countries, you have to get that approved by the Australian Psychological Society as equivalent to the 6 year study in here. So that's the pathway.
Thank you, sir.
Yep.
It looks like we have covered all the questions.
Okay.
The feedback form is given in the chat box. Please do ensure you fill the form by clearly stating your name, institution, and mail ID. Now, let me call Abarna Salim of 3rd year BSc Psychology to propose the vote of thanks.
Hello.
Hello.
Hello. Excuse me.
You're all
Can you hear me?
yes, sir.
So I was trying to get you, but due to the network problem, I was unable to. Let me. Hello, Jordi sir. Can you hear me?
Yes, I can hear you.
Yeah. See, that was the first. It was the first time. Just have an idea about the mental health tribunals.
Okay.
So that's a new concept for us. Actually, the first
Yes.
time I
Yeah.
was hearing about such a mental health tribunal. It's not in India. I think in your information, is there any such kind of tribunals in India or not? No,
Uh,
I think so.
I'm not aware of anything like that in India.
Yes.
So even in Australia, the last time Mental Health Act was renewed was in 2014, and with every time Mental Health Act is renewed, more and more privileges are given to the clients. So more protection for the clients. So compulsory treatments are possible, but they are adding layers of protection to that. So mental health tribunal is one of them. So you can there is scope for compulsory treatment, but it has to go through those criteria.
And what is the use of this mental health for the public?
Sorry, I didn't get the whole question.
For the citizens,
Sorry, you're not clear.
for normal citizen, what kind of protection is being?
Sorry.
Hello, am I audible now?
Yeah, I can hear you.
Yeah. See, what is its significance in the point of view of a normal citizen, or can we get any protection from being unauthorized mental counseling or such kind of torturing from the others? No.
Oh, okay. Yes, I got it.
As
So
a normal citizen, so
can
unauthorized
somebody
counseling, unauthorized so-called hospitalization, mental hospitalization can be prevented, right?
Yes, that can be prevented. Yes. Yeah, that is the motive behind this kind of protection. See, compulsory treatment can be initiated and provided only by the public mental health services. And usually the starting point is an assessment by a mental health practitioner. So it can be a mental health nurse or a psychologist or a social worker or an occupational therapist who is specialized in that area. So they go out to see a person who is referred for a mental health assessment. So that person, that clinician in that person, the clinician's authority, after the assessment, they decide whether this person needs compulsory treatment. So they may have mental health issues, no doubt, but that is not enough to bring them under compulsory treatment. So under the compulsory treatment, you have to go through certain criteria, and the person has to fulfill those criteria to bring in for the compulsory treatment. So which is, the person should appear to have mental health issues, mental illness, which is defined. Then if that person has mental health issues, mental illness, that should be serious enough, and it should be necessary to bring him to the treatment to protect him from self-harm or protect the safety of others, or to prevent significant deterioration in that person's physical or mental health. So this is the important criteria behind it. So if that criteria is qualified, then we can, initiate the compulsory treatment.
Okay.
So
Thank
only
you.
mental health clinicians and only the public mental health, system can, initiate compulsory treatment. Nobody else.
Thank you, sir. Let's hope such kind of a tribunal, such kind of mental health expert tribunals may be constituted in India soon. Let's hope for that. Thank you.
Yeah. So as I said, this is initiation is possible by the mental health system, but a psychiatrist can extend it up to 28 days. But after 28 days, you have to go through the little court, which is called mental health tribunal, which is constituted with a lawyer, a psychiatrist, and a representative from the community. So it can be anyone, a representative from the community. So they have to approve. We have to present the case and they have to approve that, okay, this person still needs. So, and the client get service from a lawyer to represent him with him. And that is provided free of cost. So they, by legal services. So he can, and even when we initiate a compulsory treatment, at the time when we, for example, as a mental health clinician, I authorize somebody for compulsory assessment. So I put in an assessment order. At the same time, I have to give them a statement of rights, few documents. Okay, I am putting you under compulsory treatment or compulsory assessment order, but these are your rights. So these are the numbers you can call. This is the number for the legal people. So you have to provide it either to the patient or to the patient's family or whoever he wishes. Yep.
Yeah, thank you. Thank you.
All right.
Thank you, sir. Now I call Abarna Salim, third year BSc Psychology, to propose the vote of thanks.
Am I audible, ma'am?
Yes.
Honorable Resource Person, Mr. Jody Sebastian, Lauder Principal Father Joshi Chiranguri, Vice Principal Dr. Verghese Anthony, our Department Head Dr. Angel Thomas, respected teachers, and all my dear friends, a warm and cherished morning to one and all. It was my great honor and privilege to be chosen to deliver the word of thanks on this auspicious occasion. First and foremost, I would like to thank our Almighty God for giving us this opportunity to organize a webinar series despite the present COVID-19 pandemic. I'm sure the dark phase will definitely pass away. Let's hope and pray for the same. Next, I extend my sincere gratitude to our resource person, Mr. Jody Sebastian, for enlightening us. The webinar was really an informative and inspiring and motivating session, especially for us, the aspiring psychologists. I'm sure that everyone will agree with me. And I presume everyone who has attended this section would have cleared all their worries and doubts regarding the higher educations and future endeavors. It was a great, helpful, sir. Thank you so much, sir.
Thank you.
Next, I would like to extend my gratitude to our principal, Father Joshi Chiranguri. Without his support and guidance, this webinar would not be fruitful. Thank you, Father. And I also like to thank our Vice President for his support, even in his absence. Thank you, sir. Next, I would like to extend my sincere gratitude to our HOD, Dr. Angel Thomas. Not have been a great success. Thank you, ma'am. I also take this opportunity, thank you. I also take this opportunity to thank coordinators of IQAC, Sushil sir, and Joint Coordinator Anu ma'am for their support. Thank you. Next, I would like to thank the coordinators of this webinar, Mr. Sijopi Jacob, Assistant Professor KCMT, and Ms. Catherine Mariam Samuel, Assistant Professor KCMT, and all the other teachers of Psychology Department who have worked hard to make this event a memorable one. Thank you, teachers. Finally, I would like to thank all the students for your valuable presence and attention throughout the webinar. Once again, thank you all. Have a nice and a blessed day.
Thank you, Abarna. Participants, please do ensure you fill the feedback from the chat box. So we have come to the end of our webinar. On behalf of KCMT, I thank each and every one of you. We appreciate your presence. Have a happy and safe weekend. Thank you.
Thanks.